when millions of devout Hindus gathered last month in the Himalayan town of Haridwar to participate in the Kumbh Mela festival. Even as India battled a devastating second wave of coronavirus, many feared that it would turn out to be a super-spreader event. Those fears, it now seems, are coming true, with reports of Kumbh returnees testing positive, and possibly spreading the infection, coming from many parts of the country. When Mahant Shankar Das arrived in Haridwar on March 15 to participate in the festival, cases of COVID-19 were already rising in many parts of India. On April 4, just 4 days after the festival officially began, the 80-year-old Hindu priest tested positive for COVID-19 and was advised to quarantine in a tent. But instead of isolating, he packed his bags, boarded a train and traveled 1,000 kilometers, 621 miles, to the city of Varanasi. Speaking to me on the phone from his home recently, Mahant Das said he was now hale and hearty and that after his return, he had remained at home in quarantine. He insisted that he did not pass on the virus to anyone else, but within days, his son and a few other villagers also developed COVID symptoms. Mr. Pathak, who's also made a full recovery, says their village has seen 13 deaths in the past fortnight from fever and cough. The infections in the villagers may, or may not, be linked to Mahant Das, but health experts say his behavior was irresponsible and that by traveling in a crowded train and sharing a taxi, he may have spread the virus to many along the way. Epidemiologist Dr. Lalit Kant says huge groups of maskless pilgrims sitting on the river bank singing the glories of the Ganges created an ideal environment for the virus to spread rapidly. We already know that chorus singing in churches and temples are known to be super-spreader events. In Haridwar, officials said 2,642 devotees had tested positive, including dozens of top religious leaders. Akhilesh Yadav, former chief minister of neighboring Uttar Pradesh state, and Nepal's former King Gyanendra Shah and former Queen Komal Shah, were among those who tested positive after returning home. Bollywood composer Shravan Rathod died in a Mumbai hospital soon after his return from Kumbh. 9 Hindu seers from one group also perished. With growing fears that the Kumbh returnees could start to infect others, several worried state governments ordered a 14-day mandatory quarantine and warned of strict action against those who withheld information about their travels. Some made the RT-PCR test mandatory for them, but few states have a database of travelers and no state has a foolproof system of testing and tracing those entering its borders. In the past fortnight, reports of Kumbh returnees testing positive have come from all over India. Authorities in Rajasthan blame the pilgrims for the rapid spread of COVID cases in the state, especially in rural areas. At least 24 Kumbh visitors tested positive on return to the eastern state of Odisha, formerly Orissa. In Gujarat, at least 34 of a total of 313 passengers returning by one train were positive. And 60 of the 61, or 99%, returnees tested in a town in central Madhya Pradesh state were found to be infected. Officials are now frantically looking for 22 others who are missing. It's disastrous, says Dr. Kant. And these numbers are only the tip of the iceberg. The groups of pilgrims traveling in crowded trains and buses would have the multiplier effect on the number of infections. I can say without hesitation that the Kumbh Mela is one of the main reasons behind the rise in cases in India.
Thanks for watching this video. Please do subscribe All Media New York.